You're tuned into TobiTalks, episode 30. Let's talk about a real nurse of Bravo. Cary Deuber shares a spotlight about becoming a CRNFA. Did you know that nurses actually can participate in surgery? And I'm not talking about just handing the instruments off to the doctors and, making sure everything is documented. I mean, like hands-on in participate in surgery. Stitching, cutting, removing, like all of that. I had no idea. And I am so excited to talk about today's topic of becoming a certified registered nurse first assist. Now, you might know my guest as holding one of the Texas stars on The Real Housewives of Dallas, but she holds more than just a star. This woman is a boss. Not only is she going to talk about how to become a CRNFA, she talks about how she is a bomb nurse juggling a full-time practice and doing her thing on the reality show of The Housewives. So let's go ahead and hop into this conversation. Tell me about your journey and how you became a nurse.
Well, it's funny. I grew up, outside of Dallas area, and in high school, I wanted to get a job when I turned 16 because I had a car, and I was like, I want to do something. Both my parents worked, and I was like, I want to do something. And so I went to my dentist's office and asked for a job, and they gave me one.
Oh, that's real bold.
Yeah, I know. He said, he was like, he basically said, that's why I gave you the job, because you came in here on your own 2 feet and said, can I have a job?
There you go.
And so I learned about dentistry and learned, I kind of assisted him. And that's kind of where my passion came from for medicine. And then I went to Baylor University because I knew I wanted to pursue something in sciences or medicine. And I was pre-med, and then I decided to be pre-nursing after organic chemistry. And I just kind of, fell into that and loved it. And I'm more of a people person, which I think nursing is just better suited for me. After graduating from Baylor, I went to Baylor University Medical Center and did an internship in the operating room there, and then ended up staying at Baylor and did vascular and trauma surgery for several years. Until I had a friend of a friend who had a plastic surgeon that needed an assistant. And I was like, well, that's interesting. I actually went back and took my chemistry prereqs and was going to go to medical school. I had decided that I wanted to pursue a higher degree. And then I started working for the plastic surgeon, and I decided, I'm going to get my CRNFA, which is Certified Registered Nurse First Assistant. And not everybody kind of knows what that is. I did a lot of research, and there was another one at Baylor, and I thought it was really cool because you get to operate, obviously in tandem with a surgeon, but you have a lot of autonomy. And so that's what I went and did. I went to UCLA and got my CRNFA, and just been operating ever since.
Wow.
And I love it. Yeah.
You're absolutely right, because I had no idea what a CRNFA was. I didn't even know that existed.
Yeah, people always think I'm saying like CRNA, like they always think I do anesthesia, and I'm like, no, it's kind of like that, but you're operating, so you're on the other side of the curtain, so to speak. I did a lot of. I actually ended up working for Dr. Deuber, for my husband Mark, for Dr. Deuber, about, I guess, 12 years ago or 13 years ago now, because he was really into doing a lot of microvascular surgery. And, when you do that, you need 2 surgeons or a surgeon and a first assist. And so that, I knew I could be valuable in that regard. And so we did a ton of micro together. Which was a lot of fun. I always loved doing that. I mean, it's technical and tough, but I loved it.
I happened to talk to a female out here who had called me up and was wondering, like, what can I do as a nurse? I really want to go to medical school. I love surgery, but I don't really want to be there so long. Does nurses do surgery? And I literally didn't even know nurses do surgery. I was like, well, I mean, I know you can kind of help in the OR, but I don't really know that you can really, like, you know, she wanted to do like sewing and, you know, really get involved with the whole.
And that's what I do. I sew and, you know, you cut, cauterize, sew. So there, you know, you have to work within your qualifications or your, you know, your certification, but you have a lot of autonomy.
Wow. So kind of walk me through that as a first assist. So what were you doing already in the OR before you went to get your certification?
So I circulated a lot of, you know, pretty high level cases, circulating and scrubbing. So I would do, you know, just your regular RN jobs and in the operating room. And then I got my CNOR, which is a certification, so certified operating room nurse or whatever. I got that. And then I'm trying to think of all the letters after mine. I get confused. I thought, okay, I have a BSN.
There's so many abbreviations.
I know. I'm like, what do I have? I think there's like 13 letters after my name. I think I have a BSN, an RN, CNOR, and then CRNFA. So basically to get your CRNFA, people always ask me, how do you do that? So you need 2 years of operating room experience, then you can get your CNOR, and then you can go to school for your CRNFA. I chose to do it at UCLA because it gave you master's credit. So if I, you know, want to go back and get my master's, which I'm actually considering doing my FMP or my DMP right now, but I haven't decided yet. But you get that done, and then you get your RNFA from that course, from that year-long course. Then you have to get 2,000 operating hours with a preceptor, and then you can sit for your CRNFA.
Okay. So since you actually started off as a regular nurse, BSN, RN, and then you worked in the OR room for 2 years, and that's how you got your certification, which a lot of the specialties, once you do about 2 years, you can sit down and be certified.
I did 2 years. 2 years in the OR. And then I ended up working for that other doctor for, you know, many more years too. I think I had like probably 4 or 5 years before I went back to school to get my CRNFA.
So let's just say I am a high school student or I'm a new grad and I have no idea what actually goes on in the OR. So as an OR nurse, what were the kind of tasks and things that you actually did? And then we can kind of talk about how the CRNFA, how that was a changing of the role as well. So what was the kind of, you know, your workload or what did you do as an OR nurse?
So basically there's 2 roles in the operating room. So as an RN, you can circulate or you can scrub. So if you're scrubbing a case, you basically get the back table ready, which is like where all the instruments are. You make sure you have everything, you know, you load suture, pass instruments, you know, get everything that the surgeon needs, you know, passing him or her everything that they need.
Almost like that nurse on Grey's Anatomy, that old Asian nurse that's always there passing the instruments.
Yeah. So you know, you get yelled at sometimes, and, you know, more than probably anyone. And then the circulating nurse, you bring the patient, you know, you interview the patient preoperatively, you bring them into the, you know, you meet with their family, you bring them into the room, you prep them. So, you know, clean them off with soap and get them positioned along with the anesthesia provider. And then, you know, you help the scrub drape everything, you plug in all the equipment, and then you do all the documentation, and you basically run your tail off. If you know, if it's a trauma or something like that, you're getting blood, you're, you know, getting anything the anesthesia might need, and just what the surgeon needs to, and what your scrub is asking for. So, you know, you're giving saline, you're getting, you know, betadine, you're getting medications, you know, whatever is needed in the room. And you basically run the room. You call the family during surgery, and, you know, check in with them if it's a long surgery, something like that. So you're basically in charge of kind of the room.
And that's when you're scrubbing in.
That's as a circulating nurse.
Oh, that's if you're circulating. So if you're scrubbing, it's circulating. Okay. Wow. Okay.
So scrubbing, you're dealing with the instruments. Circulating, you're dealing with the room, the patient, and documenting.
Awesome. And funny enough, I was a pre-op and post-op nurse, but I never did the peri-op. So I never really knew like what really goes on inside there. So that experience is what kind of helped you now go and do your certification. So what did you get to do more differently from an OR nurse to a CRNFA?
NFA, yes.
Ooh, I'm gonna get it.
I know, it's weird, right? Yeah. So basically, you still have a circulating nurse and a scrub nurse in the room, and then you'll have a surgeon and me, and an anesthesiologist, obviously, or nurse anesthetist. And I would assist the surgeon. So I would stand across the table from him or her, and sometimes they would start on one side. Say it's like a bilateral case where you're doing bilateral breast reduction. Say that the doctor would start on their side. They would, I would help hold things, the way that they need to facilitate, the surgery. And then maybe when they're done dissecting and kind of have closed things up, then we switch sides and I finish closing, all the incisions.
Wow.
And they start the other side, and then we're done with that. Then I go over and finish. So you basically, you kind of see, like, sometimes in teaching institutions, you see residents who are doing that. And I I'm kind of like a lifelong resident.
Makes sense.
Because you kind of do some of the surgery, but not all of it. But I mean, I used to do mastectomies, and I would do one side and the mastectomy surgeon would do the other when they're bilateral. So it kind of depends on how much the surgeon trusts you and how much, you know how to do. But generally the surgeon dissects, and you can cut and coagulate. So you can use a Bobby, which is the electric artery device. You can cut, certain things, and then you can sew.
So you get more hands-on in the surgery. You actually get to be involved in it. Wow.
Right. Like the scrub nurse is handing both of us instruments. It's a little harder on them when there's two of us, but usually there's generally, most big institutions, there's usually a resident or something.
Did you get to use your OR hours to apply for your CRNFA?
So to get to go to RNFA school, I used my operating room hours. Yes, I had to have, get that certification. But then once I got my RNFA and I was about, getting ready to sit for my CRNFA, when you have to get the 2,000 hours, I used my job. So I was first assisting really already, not doing as much, obviously, kind of more superficial helping, but I used my job basically to get all of my hours and got the 2,000 hours and then took the test.
That's smart. So how was the program? No, go ahead.
It's a really good program. The thing about it is you actually you can learn every specialty. So it's not like you just take a test for CRNFA in plastics. It's everything. So it is a tough test. It was not easy. I had to study quite a bit for that. So because I can first assist in any specialty in the operating room. So sometimes I do general surgery, sometimes I do plastics. Like you can do everything.
Wow. So since it's just a certification, you said you had to, it was about a year long. So was that in class, online, and what was like the actual program like?
So all the programs are kind of different. I did the one, like I said, that was university based. And so I flew out to California, and I think I flew out like maybe 3 or 4 times throughout the year and stayed for a week each time or something like that, doing like the course, in classroom. And then I did the rest of it online and in Dallas with, my surgeon as a preceptor. So
and that was just
I flew back and forth.
Oh, okay. So
was it about a year? Took me about a year. Some people it would take longer, but I think you're supposed to get it done within a year. I think that there was I think that's what they said. And I got mine done way, within the year because I was operating so much anyhow.
That's really, really cool.
But before you go to school, you should have a preceptor. That's the thing, because I think a lot of people who went into that program didn't already have a preceptor lined up. And that's hard to do because you have to get hospital privileges, and, that takes time.
So for anyone out there who is like potentially looking to go and, get their CRNFA, they already in the OR, how do they go about even getting a preceptor? Because I even hear for like, nurse practitioners that are in NP school, they're having difficulties finding someone to shadow. So technically you already had someone set up, but like were there any advice that other people, that were in the program with you? Like what did they do to get a preceptor?
I mean, I don't know. I think some of them had a tough time. I mean, I was lucky in that I already had a job. I already had a job helping out, helping a surgeon, basically assisting a surgeon. I just, it kind of was chicken, before the egg kind of thing.
Yeah, which seems to be smart though. That seems to be the smart route.
Yeah. So I already had hospital privileges, already had everything lined up because it was a long time ago. It was before you had to have all of the qualifications and, all of that before getting hospital privileges. But now, I mean, I would say, just go to a big hospital that has a lot of surgeons. And I mean, you'll find somebody who's going to need help and, it's all about kind of who you know. And if you're already in the nursing world, if you work on a floor or whatever, you can just talk to some doctors and see, if they need help.
Start doing your networking inside the hospital.
Yep. Yeah.
That's so true.
Yeah.
So I just want to hear from your perspective, like, what were the differences or what do you enjoy more about being a CRNFA versus just being an OR nurse? Is it the time, the schedule, the pay? Like, is there a huge pay difference when you got your certification? Like, what were some of the differences between those two?
Yeah, I mean, for me, back in the day, it was a huge pay difference because you still bill insurance companies for what you do. So just like a surgeon, a PA, a nurse practitioner, you bill insurance companies. Oh. So you get paid by insurance companies, which, is generally more. Now they've kind of changed some of the laws some of the payouts with that. And I think, surgeons even, don't get paid as much anymore with insurance companies. So that's, I still think you would probably get paid more, but you have to work a lot of hours. You're doing a lot of surgery and working quite a bit. You're not working like a 7 to 7 shift. You're usually working what your surgeon's working. So it just kind of depends on them.
Okay.
But I did like it better in that I had more autonomy and I got to pick the surgeons that I work with. When you're in the hospital in the operating room, they just throw you in a room and, good luck. You might be with the biggest,
jerk in the room. You
on the planet. Yeah. And you're like, great. My day is going to suck. Once I have the job where I'm like, I get to pick who I work with. For me, that's a lot better, just personality wise.
And do you get to pick your, how much since you get to work with the surgeon, you get to pick how much you charge, or is there a certain set standard price depending on your surgery?
I mean, I think generally First Assist probably bill surgeons probably on the low end, 50 an hour, on the high end, 100. If they're not getting paid by insurance, if they're not getting reimbursed. So, you can get an hourly. Yeah. But I mean, I was salary. So I was salary with Dr. Deuber and with Dr. Lester, and then I billed insurance on top.
Oh, okay. Girl, you bringing in bank. Okay.
Yeah. I'm real good, girl.
Come on.
I mean, and part of it is that, you got to be really good at what you do. I mean, I made it to where those guys couldn't live without me. And I had another breast surgeon that, she loved working with me too. And so, they don't want to go to work and do all the work without you either, because they get to where they need you, and it's a lot easier on them.
You are a quality CRNFA. That was the quality. They wanted someone who knew their stuff and was good to work with, and that's because I think
it's hard to find. Yeah, I mean, it's hard to find somebody that you click with and that knows what they're doing and is really good, and you can trust. With a patient of yours, it's a big liability.
That is so true. So now I kind of want to turn the tables a little bit because, you're not just only, an RNFA, you are a businesswoman, you are running a practice. So
I am. It's new.
That is
new for me.
amazing. That is
I can operate
amazing.
standing on my head, but then running a business, I'm like, oh God.
Look, I
mean,
had the honor of getting to see your plastic surgery and laser center, and it is gorgeous, by the way.
Thank you.
So
Thank you.
it's really motivating because, hearing that, you're an RN, you have these certifications, and you're also a businesswoman. So how did all that play a role into how were you able to open, your laser center and be like, the nurse that's fully in charge of all the injectables and elective surgeries and stuff like that? How did that come about?
It just kind of evolved. It just kind of happened. I mean, I would probably say that some of it was probably from housewives, because I kind of had to take a step back from operating quite so much. And I needed to find something that I could do more on my schedule, and with having kids, it's hard, and I want to be home at night. I don't want to be at work. I want to be home with my family. Like, that's the most important thing to me. And so I actually, a laser tech, Paul, our amazing laser technician, he walked in our office with a resume, and we didn't have a laser, and he said, I'd love to work for you guys. And I was like, okay. And I looked into it, and he's fantastic. And I was like, this is it. And I really just bit the bullet and was like, we're going to do this. And bought $1 million of lasers. Luckily my husband, can financially support that and also do the books, because he was an investment banker prior to being a physician, which is just amazing.
Girl, you got all the good chips in one bag. Come on.
Yes, because he can like do a spreadsheet, and I'm like sitting there going, what?
They didn't teach us that in
that's
nursing
not
school.
my thing. Oh God, I hate math. And so he does the finance aspect of it, but I do all the managerial role and ordering, making sure everything's there. And then I still, I inject 2 days a week. So I have my own patients. And then I've got, I think there's, 4 nurse injectors at this point, two laser technicians in the practice now. So we're growing. I mean, it to be honest, I think it's probably 10 times the amount of what I thought it was going to be.
Wow. And all because you got the balls to just start. That
was the main thing, is really just having the balls to do it. Like, just being like, you know what, I can do this. I know I can do this. And, I would have to thank my husband for also, being a really strong, smart businessman. Because not a lot of doctors are. We will find that doctors are terrible at business as a whole, and he's fantastic. So that was a big help.
I appreciate the fact that you're even sharing, this aspect of it, because, there's a lot of nurses out there that there's this perception that you either need to be in the hospital care setting for like 50 plus years or, have a DNP or, a higher credential to actually just do an entrepreneurial spirit of owning your business and something that you're really good at. And you've been blessed to be so good at what you do that you've established, a whole laser center on top of that. And that's like, being a woman, being a nurse, being a mother, being a businesswoman, you're being able to handle all this. And on top of this, you are a reality celebrity. You're on TV. So how do you balance all of this roles as all your different titles?
It's a lot. I'm not gonna lie, it's a lot. I'm just one of those people. I love what I do, and I'm a very ambitious person, and I can't idle hands. I can't sit still. So I'm always just going. I enjoy working. The reality TV aspect of my life has been very interesting. I've learned a lot. I've learned a lot about myself. I've learned a lot about people. Which probably helps manage people. You can take that subset of skills and use it throughout your life. And, so it's been interesting, but it's a lot to juggle, it's a lot to juggle. But my business is really, my family and my business are number one for sure.
And that's awesome. And I'm glad that you're even saying that, because sometimes, when you do get to see someone's life from the TV, you expect it to be like, oh, everything is just so perfect, it's so glamorous, but behind the scenes, being in all these various roles, especially running your own, your own practice.
Oh, girl, I'm sitting here in my sweatpants and my sweatshirt, and like, I'm so, I'm probably like, I'm just like the most chill, like down to earth, like person, and so, I feel like the housewife thing is cool and like entertaining, and it's been very interesting.
Mm-hmm.
But I feel like I'm very different than especially my other castmates and so forth, just because I do own a business. I am constantly going. I am juggling a lot.
And did Bravo give you the opportunity to be able to showcase that business aspect of you? Because I know way back when the Reality Housewives franchise started, it was more focused on just being a housewife. And clearly in this generation and movement that we're in, we're not just housewives. So, were they able to give you this platform to also speak about the businesses that you do? And like, because obviously that's how I knew about you. Clearly you've been able to showcase that.
Yeah. So, I think Bravo does a good job of just, following you in your life and what's going on with you. So, they knew that's what was going on with me, and that my career is really important to me. And that's something that for me is really important to highlight, because I don't think you see that a lot on all these shows. You see, all the different housewifey, type businesses, which are great and entertaining and I think pretty cool. But, I didn't go that route. I just built out my practice, which is what I really, really was my goal. And I just stuck with it, and did it. Cause, I could have like developed pink Botox or something, some kind of, I don't know, just
something random.
Right.
You do have an amazing skincare line. So let's not even
yes, I do.
not play
That's
that
right.
up.
That's right. Yes, I do have an amazing skincare line. That's really what, so I would say, at first you kind of look at those businesses and you're like, oh, it's, all silly. But I'm very proud of the business that I've built, and I feel like part of it is because of the show gave me the platform to feel comfortable and like you said, the balls to do it. And now I have exactly what I wanted, which is a place where I know that people can come, and in medicine you find people, especially with cosmetic stuff, they don't know where to go, and they'll go somewhere from Groupon or something and get jacked up. I want people to be able to come to our place and know they're going to get amazing care in any aspect. So, whether that be laser, whether that be injectables, whether it be surgery, whether it be skincare, like we have everything there, and it's all people that I trust implicitly. And that for me to be able to have that and offer that, because it nothing pisses me off more than somebody getting bad care somewhere. Yes. And then we have to fix it. And, then they're in, having to pay a bunch of money for it. The most important thing for me is quality, quality over quantity.
That's why I went into becoming a quality improvement nurse, because that to me was the biggest deal. Yeah. Like, people are out there getting their healthcare, but they're just, no one should get like a McDonald's service healthcare. Like, your healthcare should be 5-star no matter anywhere you go.
Absolutely. They should be Neiman Marcus no matter what.
No matter what. Exactly.
Yeah.
So
I don't care. Yeah. It's just so important.
It is. And a lot of times,
and for the lay person, they don't know that.
Yes.
And that's what's frustrating to me about some of the climate, especially in the plastic surgery world. Is that's frustrating to me, because it's not fair. It's just
and
not
I
fair.
think because people, they automatically trust the credentials. They automatically trust the position that, okay, I'm coming to this position, I'm coming to get this care, that I'm going to get the same standard care that I'm seeing everyone else have, but it's not true. And that's the sad part. You really have to do your research. You really have to see the actual practice for itself, and see the kind of ratings they have. And, those things really mean a lot. So how do you go about making sure that your practice has that quality standard. With your, you have a lot of different roles there. You have nurses that are giving injections, you have your frontline staff and the that are, checking in patients, and then you have your surgeons. So how do you balance all that and make sure that you're giving that quality care, that patients are getting that satisfaction when they're coming in, to give up their most vulnerable thing about them, which is their body, their physical appearance?
Right. I mean, for me, it's all about hiring the right people and just, not just credentials, like you said, but knowing a lot about them before they come to our practice, doing my research on them and making sure that they're top notch, and have a lot of experience. I think that it's important for somebody to have, you learn so much every day in medicine, and, I want to make sure that they have a good background.
That's so important. That's so important. So I kind of want to switch gears a little bit. Because I just want to get from your perspective on just being in this field. And it sounds like it's amazing, but, in the reality, everything that, glitters is not gold. So are there any aspects of being a RNFA that were challenging, even, prior to opening your practice or prior to even getting, certified? Was there any aspects that were challenging, or that you felt like this was a good lesson I learned and I wish I shared this, or someone would have told me about it when I was in this role?
Yeah, I mean, probably early on in my practice, the most challenging thing as a first assistant would be just, it's nerve-wracking operating on people. I mean, you got to really, again, have balls and, be able to be like, okay, I can do this, and have the confidence, I guess. And, later in my practice, gosh, probably just for now, I mean, now with RNFA, I mean, I don't do as much with that. I'm more in the managerial role, and I would say just managing people is a lot harder than I think I ever realized. When you had like the crotchety nurse manager, and you're like,
what's the hardest part of that managing aspect? Because I hear that a lot, and I've seen it. I mean, I've had to manage staff too, and it was like, okay.
Yeah, just managing personalities and egos. That's a big thing. Because I think anybody who's good in medicine has a pretty big ego. I mean, I'm just going to say it. I mean,
so true.
And so we're all really good. That's what I'll say.
Okay. And then when you challenge, my goodness, I got a problem.
Yeah. So, it's stuff like that. But in the end, it all works out, and, it's all been positive. It's just that initial fear, I think fear of the unknown, fear of screwing up, something
true.
that you don't have experience in.
Yeah. I mean, that's a good perspective. Yeah. That's a really good perspective. I didn't think of it as, I thought and that's true. I mean, a lot of people say that too. Like, they have this perception that once you move from the bedside and you go into administration, the bedside nurses are envying the nurses that are in administration because they think it's so easy and you're living a better life versus there. And it's like, nope. Every grass has its own version of green. Okay.
That's right. I mean, just, managing people can be, just as annoying as emptying bedpans.
Hello. But at least the bedpan don't talk back, so you can empty it and come about your day.
That's exactly right. I mean, inanimate objects are sometimes a lot easier. Or being thrown up on,
right?
Is sometimes easier than being yelled at. So, it's always something.
That's so true. And it's always having to understand that perspective. So as we kind of wrap up the show today, I actually want to get you to just share with your own like inspiration or your own encouragement to those who are actually, first time hearing about, a certified registered nurse first assist, who are probably scared or they're getting burnt out and they don't know like what area of nursing they want to do. What encouragement would you just give nurses out there, period? Those that are getting into nursing school, those who are actually getting into the bedside, and those who are actually about to start this journey of a CRNFA. Like, what advice would you give them to keep going and not give up?
I mean, for me, I feel like everything in life is kind of, you've got to, it's what you put your mind to, and it's a hustle, and just keep at it. I mean, you'll get there. And whatever you want to do, just put your mind to it, and you can do it. You can accomplish the goal. Just have faith in it and have the confidence to, branch out and do what you want and be the person that you can be and push for it. If you want to go to school, go to school. If you can't do it full time, start slow, or, find where you want to be and don't settle with something that you're not happy with.
I hope you've enjoyed today's podcast episode. There were so many gems dropped. But let's be honest, who got time to replay, pause, and write down all that information shared? Shoo, I know I don't. But don't worry, I got you. Download TobiTalks app on Google Play for nursing resources, definitions, and so much more that were mentioned on today's episode. TobiTalk app features show notes that timelines the conversation and lets you click directly to the resource or definition. And it even lets you bookmark the gem for later. Listen, we're too busy learning how to save lives or even saving lives as nurses to deal with a replay button. TobiTalk app is your one-stop shop for podcast episodes and show notes. For more on TobiTalks, like the blogs and videos, go to my website at www.tobitalks.com. And I love to hear from you guys, so feel free to slide into my DMs on IG or Facebook and hit me up through email. That's tobitalks@tobitalks.com. Again, that's tobitalks@tobitalks.com. Till next time, I'll be talking to you soon.